Welcome to High Impact Growth, a podcast from Demagi about the role of technology in creating a world where everyone has access to the services they need to thrive. I'm Amy Vaccaro, Senior Director of Marketing at Demagi and your co-host. Today we have a really interesting episode for you. I'm going to go as far as to say this is a must listen for anyone building digital health tools. This is the next installment in our Dispatches from Global Digital Health Forum series, recorded on the sidelines of the event in December 2022. Today, my co-host Jonathan Jackson sits down with Mr. Simeon Yosefe, who's head of digital health for the Ministry of Health in Malawi, to discuss the challenges and opportunities of digital health in Malawi. What's most fascinating about this conversation to me is hearing about Mr. Yosefe's pain points. Digital health projects happening in silos, being project-based and lacking sustainability models, partners prioritizing looking good and showcasing success over actually aligning to Malawi's vision, and potentially being unwilling to do the most important work needed, fragmentation of digital health systems, and what happens when there's a lack of buy-in from the government from the beginning of a project. In this episode, Mr. Simeon Yosefe shares his approach within Malawi that contains rich advice both for digital health companies like Demagi, as well as for Ministries of Health looking to unlock the potential of digital transformation on their health system. Enjoy.
Welcome to High Impact Growth. I'm here with Simeon from the Ministry of Health in Malawi at the Global Digital Health Forum. Very excited to speak. Simeon, can you start just by sharing your background and your role within the Ministry of Health?
Yeah, I'm Simeon Yosefe. Currently, I'm actually head of digital health in Malawi. My background is not really from IT field. I'm a statistician by profession. So I have spent all my years as a statistician. And I started now focusing on the technology, I think starting from 2014 when I joined the Ministry of Health, because I actually intended to change the way things are done within the ministry, especially in terms of data management. And when that happened, the issues of now probably digitalizing the services came in. And then, we actually took it from there. And up to now, the ministry actually appointed me to head digital health.
Wonderful. That's a big role. Malawi has been at the forefront of some amazing digital work over the years and has an aggressive and bold strategy going forward. Can you share a bit about the projects that you've overseen so far and what you have in your roadmap coming up?
In terms of the projects, we have quite a number of them. I think serious changes have actually started to take shape in 2021 after COVID, but also when the management of the department actually changed hands from the initial department where digital health was allocated, Directorate of Quality, to planning, where now I was actually made to actually head the digital health division. We actually looked at the way things were done, and then that most of the investments in digital health were actually siloed, were project-based. And because they were project-based, most of the issues would actually probably lack sustainability. We have so many systems that were actually probably deployed by various partners who actually wanted to invest in digital health. And these systems have not really made it so long after the expiry of probably the grant that actually initiated the system. And when we looked at the moment I just came in, I looked at the issue of trying to understand what the landscape is like. So we did an assessment, and then we actually discovered that we had more than 40 different systems running in the sphere. And that was not sustainable. And some of these systems probably they had actually died long time ago, but they were still being reported that we have these kind of systems in the facilities. And the other issue was like these systems were mostly named after who actually initiated or who actually implemented that. So there was not that kind of ownership from the facilities where the systems were running, because it was actually named after the partner who supported. So if the support goes, even the healthcare workers who were using the system also stop using the system because it doesn't actually have any support any longer. And that has really affected the way systems are and even the gadgets, because they could not be maintained. The ones who were supposed to come to maintain the gadgets are not there. So it has actually put us in a very awkward situation. And in some instances, you could actually probably have a situation where partners come say, okay, our grant is coming to an end. We want you to adopt this system. And what I have always actually said to people is that, or to the partners, is that for government to actually adopt a system, it's not an easy thing, because if they were not actually engaged from the word go, then it means they were not actually planning for it. And for you to say, okay, we want you to take this, while they were not actually prepared, then that means that system is not going to have the support that is required. In the end, it's going to die. So after that, I said, no, let's do the assessment of all these different systems that we had. We did the assessment. We actually realized that these systems were just duplicating each other. And what was really sad at that time, it was like much of the work or much of the resources that were spent would have actually been put to a better use if we were more coordinated. And then I said, okay, in that case, let's try to establish these systems and see which ones are actually just duplicating the other, and see if we could probably, if those that are duplicating each other, if they could just be made to run on the same platform. And then have those people who are supporting those kind of systems come together and support that. And the other thing that I also discovered in working in that area is that I think partners, they have a very good motive of actually coming in to work, but then the issue that really takes the center stage is the issue of visibility. They want to be seen that they are the ones who have actually probably implemented A, B, C, D. In the end, it actually makes them to start working in a more of competitive way instead of being complementary to each other. So we are also trying to regulate those kind of things. And the other area that we felt really needed attention is the area of infrastructure. Much of the projects that I have mentioned, whether you are talking of the EMRs that have been deployed in the facilities whatsoever, you talk of probably community-based whatsoever, we have lacked infrastructure that could sustain these different systems. And because of that, we started now seeing what is it that we can do best. And then we started probably emphasizing this to all the partners that, no, if you really want to work with us in digital health, you also need to focus your attention on the infrastructure, because we can't keep on, let's say, for example, someone comes with a dongle or comes with a MiFi. A MiFi or a dongle, if it has actually probably stayed stronger, it will not actually exceed 2 years. It's going to be gone. And that was the situation where now a lot of partners will actually say, okay, we are implementing this. We are actually giving you this dongle. We will be giving you a data bundle so that you can actually do this. We are trying to get rid of that so that we now focus on long-term investments. And yeah, it's good that now it's opening up. We partners have actually opened up. They are actually willing to probably bring long-term infrastructure. And I'm sure we are going to actually get better. I think by the end of 2023, we should have something bigger done within the country.
That's great to hear, Simeon. And we've been working in Malawi for over a decade and have seen this huge shift, as you said. It used to be very partner-led, doing a lot of vertical programs that were all going away at the end of the funding cycle, to this much more strategic position. That obviously sounds like the right way to do it, but is difficult to get there. So as you've gone through this process and the government's gone through this process, what successes and recommendations have you had in how you were able to transform this mindset, and what challenges did you bump into? You mentioned visibility and partner motivations, and this is a huge problem. As a tech partner, we want to serve the government and the strategy you have, but obviously we're also chasing funding. So exactly as you said, we have that conflict where on the one hand, yes, of course, we want to align to the national digital strategy, but on the other, we want to get, funded for our work. And so absolutely right. But yeah, we'd love to hear successes and challenges.
The first thing that I actually undertook, even before doing the assessment of the different systems that are being implemented by different partners, what I did first was to actually harmonize the work plans for all the players in digital health. Because why I actually decided, I pushed for that, is to understand what is it that the partners are focusing. Because I know that their partners, when they come, they have specific areas of interest. What is it that they want to put their resources on so that they could actually get what is it that they're interested in? Much as they actually are supporting us, they also have the interest that they would actually want to get from this investment. So what I did was to make sure that the work plans are actually harmonized. We pull these together. We see where are much resources going and which areas are actually neglected. It's when we actually identified that infrastructure was one of the neglected components, because a lot of partners were running away from that. They were just focusing on somewhere where they could probably get the results immediately. Probably within months, they get whatever they want and then off they go. So we actually thought of, okay, let's try to harmonize our work plans, and we see where we have duplications and how much resources can we free for where there are duplications, so that we can now shift these resources to the areas which are neglected. It's when now we started talking of what kind of infrastructure. Okay, we need to come up with the blueprints for the infrastructure. When we are actually talking of putting up infrastructure in the facilities, what should be the standards? That blueprint was actually prepared. And then in terms of, okay, when we want actually to talk of like the connectivity, what are we talking about? What is it that it needs to include? We actually had all those. And then we had launch of the digital health strategy, which is now a blueprint for us to actually see where we are going to go. And then I still realized that we were lacking the enforcement mechanism. Because whatever we were doing, we did not have a regulatory document which would really like enforce that, okay, if someone breaches this, what would be like the outcome? So we realized that we didn't really have that guiding document, which was a policy. At the moment, we are like in the final stages of drafting the policy. What is remaining now is to actually probably come up with a cabinet paper, which is actually going to present this policy to cabinet for deliberations, and possible deliberations in parliament for it to actually be passed. Why we have actually done that is like we don't want like partners to have like a leeway, or in other ways to find a loophole that, okay, we can do this. We will say, no, we didn't have any like regulatory, what is it that we have actually contravened, or what framework have we actually breached? We would not actually have anything. So what we want is, okay, this is what we are looking at. We have actually indicated the issues of how can new systems be brought into the sphere, because that's very critical. And someone cannot just decide today that, okay, I have this system, I have developed this system, I want this to be implemented. It will actually have to go through a rigorous process for it to be approved, so that it's actually deployed within the sector. We are doing all those to bring sanity, but at the same time to make sure that whatever investments we are making in that area, they are actually sustainable. So yeah, those are the kind of situations. I think in terms of the challenges, I think initially the implementers and partners all together, they did not really understand what was the concept that we were trying to put forth. They thought that we just want probably to like tell people to stop using their systems whatsoever. They didn't understand that what we are trying to look at is the issue of sustainability. So after we had actually taken the process, engaging them whatsoever, now everybody actually understood that was the best direction for us to take, much as it would mean that some of the systems that probably partners have actually cherished most will actually have to be discontinued, but we have to do that for the sake of the country. And we want to make sure that whenever we are coming in with the resources, with support, it should really be going to where it's going to make the difference, so that the common people of Malawi actually benefit from these investments.
That's great. And the need to have a clarifying policy, I think, is a huge thing to stress, because it's one thing for all the partners to agree to have a technical working group and align behind a vision until it conflicts with their grant deliverable, or until it is financially not in their interest. Then all of a sudden they work around the system. And so I think going into that policy framework, giving it real clarity and teeth, to say, look, partners, if you want to be here to support the Malawi people, you're going to get behind this policy document. That sounds like excellent advice. One of the things I've been talking with other partners about, and I mentioned this on my panel within the Ethiopian context, is defining shared value. Defining, we're going to pay $1 million for this system over 5 years. What's the health outcome we're going to get as a result? How do you think about that, and how have you reached that level of discussion within the policy or the strategy that you're having in terms of not just what do we think is going to happen, but how do we reevaluate whether this is having the value we expected it to have and either continue or discontinue? Because these digital health investments, they're not one time, right? You have to continue to operate them with scarce resources. And so how do you think about that challenge?
Yeah, we really have challenges because when partners are actually investing, they have specific deliverables that they would want to see. They have specific issues that they want to achieve within a certain period. Now, having that in mind, what I have always probably discussed with the team or the partners as they come is that as government, we have a broader vision of where we want to go. Now, as we have a broader vision, whatever partners really want is a subset of what government wants. So as they are trying to support that subset that they are interested in, they should not only focus on that subset, but they should focus the whole vision that government has. Because it's by doing that, they will not only support what they are interested in, but they also drive the agenda of the government. Now, why that is very critical? As a government, we have a wide range of areas where we really see that here there is a need that we really need to address. Well, for an implementing partner or the donor, they would just be interested. I can give an example of probably PEPFAR. PEPFAR would be interested in issues only to do with HIV. But for us, what we are actually saying now is, okay, we can actually talk of HIV, yes. But what about the person who is both HIV, has TB, is actually pregnant, or has some kind of non-communicable diseases? What is going to happen with this person? Will you only take care of the HIV component? And then we had discussions. At that point, they said, okay, no, I think in that case, we should actually start flexing our procedures and rules that really govern our support whatsoever. Because what I have always said is, if you go in countries, and this is happening to most countries, you actually hear that, no, for us, we had HIV system is doing very well because it's supported by CDC or it's supported by PEPFAR, it's supported by this one. They have moved in that. But then what about the other components that they are leaving out, which are actually found within the same patient who is HIV positive? They haven't taken care of these. And we had really discussions on this, and we finally agreed that, okay, now it has to be opened up. So that's where now what we said is, okay, for us as a country, we want to deploy comprehensive systems, a system that actually encompasses everything, not only focusing on one component. HIV may be a starting point, but we want these resources not only to be limited to HIV, but they should cover everything. And by doing that, we'll ensure that we are taking care of everything. If a mother is pregnant, is HIV positive, or is also TB, all these will actually be taken care of because we have brought all this work together. And those who are providing the care will actually provide this care within the same framework and the same environment. That will definitely improve the situation. So we had those kind of discussions, and it was not easy to actually drive home the point, but we actually made it.
That's such an amazing example, and I think is reflected in a lot of PEPFAR's global thinking now in their latest release of their 5-year strategy. It's exactly resonant with what you just said. And not only that, but it's often cheaper to do it the right way. Siloing off these digital systems for these vertical use cases can often be harder than making it comprehensive for all of these different functions at the clinic, at the community level. So just an excellent point. Simeon, thank you so much for coming by. We really appreciated the time.
Thank you so much to Mr. Simeon Yosefe. There was a lot of rich guidance, both for people within Ministries of Health and digital health partners working on technology solutions. I wanted to share a couple of my quick takeaways. First, digital health providers need to align closely to the vision and digital health strategy of the government of the country that they're working in. Second, Malawi is working on policy guidance that will ensure that digital health systems work for Malawi. This seems like a really strong move to ensure that partners are aligned to the government and its goals, and that donor or partner priorities don't conflict. Lastly, I heard so clearly the need for digital systems to take a comprehensive and human-centered approach. I love Mr. Yosefe's example of a woman with HIV who might also be pregnant, and a program and digital tool that only supports HIV just doesn't work. We are whole, complex people with intersecting needs, and digital technology needs to support all aspects of well-being. Thank you so much. Please like, rate, review, subscribe, and share this episode if you found it useful. It really helps us grow our impact. And write to us at podcast@demagi.com with any ideas, comments, or feedback.